Asian Pacific Islander School Board meeting. Excuse me, Asian Pacific Islander School Board Association is a statewide organization. It's a nonprofit, and it's been around for more than 20 years. Not even sure. And we have this really awesome panel here today with us. We thank them for being here with us. They will be introduced in a second. And we also have our legislator, Alex Lee, here with us today. Thank you so much. He will be a facilitator with us today. And just FYI, the APISBMA, Asian Pacific Islander School Board Association, is dedicated to uplifting the needs of AAPI students throughout the state of California by supporting school board members and superintendents and other educators, leaders in school, to really figure out what do our API kids need. You know, as we're talking about equity, and oftentimes they're overlooked and their unique needs are hidden and invisible. So I think today's Zoom meeting of health and well-being of our API kids is going to help uncover some of that. So we're really excited to have this panel here today. We're going to learn a lot. I'm going to learn a lot. The first thing we're going to do is just let you know that we are recording. It will be available to you after. And we also would like to take a poll. So we're going to do a poll just a few seconds right now and just kind of see who's in our audience, so our panelists can figure out who they're talking to. So we'll put that up right now and we'll ask you to do that. You are also welcome to type things in the chat. If you have comments, questions, needs, throw that in the chat. We'll be monitoring that. And we will ask you to stay muted, but we'll watch the chat. Okay, are we going to get to see the results of the poll? Sylvia's doing this.
Yeah, is it not sharing?
It is sharing, Sylvia.
Okay. So it looks like we've got about 66% school board members, 13% school administrators, and about 20 other percent that are either other educator or non-education. And then majority right now from Northern California. So thanks everyone for letting us know who's in the room with us.
Okay, I appreciate it. So if you're just joining us again, welcome to the health and well-being, mental health well-being of API students. And we are going to get into this further with an introduction of our panelists, and our board member, Naomi, is going to take this part.
Okay, thank you, Lori, and welcome everyone. I am so excited for this panel and what these distinguished professionals will be bringing today to us. As Mary, one of our panelists, said, this is a time where professional and personal get to come together. And for me, I know each of the panelists. I do have a new friend in Nira, and I'm looking forward to working with her more in the future. But all of you, the rest of the panelists, I know from some for decades and some maybe, within the last 5 or 6 years. And so I will go over their names and their titles, and instead of going through all of their credentials, because we could spend the whole hour and a half talking about all the credentials that they have professionally and personally, and the extensive experience that they bring. But I'm going to be asking them to do something a little bit different so you can get to know them in a different way. So first we have Cheryl Gloner. She is the CEO of Project Safety Net. We have Nira Singh, Psy.D, who is the Director of Behavioral Health at AACI, which is Asian Americans for Community Involvement. Razelle Buenavista, who is the Managing Director of Asian American Recovery Service, a project of Health Right 360. And then David Mineta, who is the CEO for Momentum for Health. And then Assemblymember Alex Lee, who is with the 25th Assembly District. And so what I'm asking them is that all of us come from very rich cultures and traditions. Please share with us a word or a phrase, a value from your culture or tradition that you would like to share with the youth in your community. And I'm going to ask Mary to start off and then hand it off to someone else after that. So thank you.
All right, thank you so much for having me here and along with this wonderful panel. So as a Filipino American, the saying I'm going to share is utang na loob. And the literal translation is "oh from inside," but it's an expression of indebtedness. What I learned from my own mother and my grandmother and before them, it's about actually respecting, remembering, and celebrating those who were instrumental in paving the positive path in our life, and being mindful to protect against the negative aspects of holding this debt over another person or forgetting to honor those who had helped us. So I'm going to turn it over to Dave Mineta.
Thank you, Mary. Again, thank you all. Thank you, Naomi. Thank you, APISBMA, for having us. As a Sansei, a Japanese American, the term that came to mind for me was gaman. And it's a Japanese term of Buddhist origin, which means enduring kind of the seemingly unbearable with patience and dignity. And in our family, that translated to really just perseverance in really during very difficult times as individuals and as a family. And I think it's common to many cultures, so people will relate to that. I will ask Assemblyman Lee.
Thank you, David. Well, I will just do since I am a child as an Asian American who grew up in the 90s, I am going to use the term self-care. So if you have not heard this term before, self-care is as simple as it sounds, right? It's taking care of yourself, especially for your well-being, your physical being, but it is a new term. And I still remember as recently as in college, it was still being coined and solidified. And it really takes against the action, it bumps up against how do we make sure we are balanced in our life to take care of ourselves, but also without seeming lazy in the culture of high productivity, right? So self-care originally was very, very contentious of a term, but now has become much more mainstream. It's still obviously not as mainstream as I think it ought to be, but it's a very simple reminder that we ought to take care of ourselves and not let our busy lives overrun ourselves. I'll pass it over to Razelle.
Hi, everybody. First of all, I identify as Pinay or Filipino American. And so in Tagalog, there is a word, magkasama. And I don't speak the language, but I hear my family members use that a lot. And the word means together. And when I think of magkasama, I think of how our AAPI, Asian Pacific Islander cultures, are very collective in nature. So the word together to me is really important when I think about the youth and our community, to make sure that they know that they're not alone. They're not alone in the pain that they feel, the experiences that they go through, that they don't have to suffer alone in silence when they feel that they are going through something that somebody else is not, because there is always somebody that can relate to it or has experienced something very similar. And so when our youth that we work with and clients in general come to us, I want them to know that this is a together moment. This is something that collectively as an ARS family member, we will help support you and in any other way that they can for recovery's sake. And I will pass it over to Nira.
Thank you. I'm so happy to be here today and to share. When I was, thinking about what would be a word or phrase or value from my culture or tradition that I'd like to share with the youth and the community, I was thinking of what are the sort of proverbs and sayings that my elders in my family shared with me as a second generation South Asian American. And two things stood out to me. One was a proverb for when things would feel overwhelming or insurmountable, and that was, the journey of 1,000 miles starts with a single step. And that idea of just one act of reaching out, one connection can make a difference. That idea of one step at a time, one day at a time. And the other one was a quote from Gandhi, and that is that freedom is not worth having if it doesn't include the freedom to make mistakes. And it just makes me think of our youth that can be so hard on themselves these days, and how that can feed into that model myth, a minority myth of how they must perform and handle adversity, and that it's okay to make mistakes. So those were the two that stood out for me.
So thank you to our panelists. I know that, as I said earlier, that all of us can Google and learn all about you, but what you brought today is beautiful. And one of the reasons why I asked each of you to come and be part of this is that you bring your wisdom and your compassion together to this panel. And so thank you. I'm now going to turn it over to Assemblymember Lee.
Thank you, Naomi. Well, welcome everyone. There's so many great local leaders from across California on here, whether you're on a school board or you're a city council member, or you're just interested in making sure that our, especially young people, are mentally well. Is really great to have you all today. So really, I think the big overview of this conversation today, you're gonna have a lot of great experts on here talking about what are the trends, what are the recourses to make sure people, or programs that can help people feel better, but also want to give you a sense of how big this problem is. And also want to make sure we take away that you have ways you can also advocate for your young people, especially AAPI young people, to make sure their mental health is being taken care of. I want to give you a quick overview about what the ethnic background of California really looks like too. AAPI students, Asian American Pacific Islander students, come from multiple ethnic backgrounds and make up 12% of California's 2019 and 2020 enrollment. And when disaggregated, students of Asian descent make up more than 9%, or make up 9% of the state's total enrollment. The backgrounds of the over 500,000 students of Asian descent in California include Asian Indian, Cambodian, Chinese, Hmong, Japanese, Korean, Laotian, and Vietnamese. And nearly 30,000 students of Pacific Islander descent include students from who are Guamanian, Hawaiian, Samoan, and Tahitian backgrounds, represent 0.4% of all students. There are also over 140,000 Filipino American students in California in 2019, and that accounts for 2% of California students. And the number of API students, of course, enrolled by county varies widely across California. And in fact, the district that I represent, which is northern Santa Clara County and southern Alameda County in the state assembly, which has about 500,000 people in it, is actually one of 2 Asian American majority districts in the entire state. My congressional district that I'm nested in is the only Asian American majority district in the entire mainland United States. And when I went to school, I think this is still true now, over 50% of the school is of Asian American heritage. But that is, of course, not true from every county, right? Of 58 counties, 57 have local education agencies that enroll AAPI students. Alpine County was the only county with no Asian students enrolled in the 2019-2020 academic year. And 54% of all API students attend school in just 4 counties: Los Angeles, Santa Clara, which is my home county, Orange, and Alameda, also my home county. Santa Clara County has the highest proportion of AAPI students, with over 93,000 of its over 270,000 students. That's 34%. And besides Alpine County, Sierra County has the lowest portion of Asian American students. And that's just to give you an overview of how diverse even our own diverse community is and how different the population concentrations are. Today, we want to have a conversation about, what the emerging trends are and how you as a policymaker, as a leader, can make a difference in this. So I'm going to do like quick questions to each of our panelists, targeted for each of our panelists. And if, of course, any of the other panelists have something to add or contribute, feel free to maybe use raise your hand function or visually raise your hand at some point so I can also see. But I'm happy to facilitate this conversation. And we're first going to actually start with Mary, if that's all right. We're going to start a question for you, Mary. So, of course, you run Project Safety Net, which was originally founded to provide support and resources for youth suicide prevention. And your organization has grown a lot since then. What are the trends today that you are seeing with AAPI students, and what are the ways you're addressing these issues? So first, what are the trends and what are some of the ways we address it?
Thank you for asking that question. So before I dive immediately into the trends that I'm seeing, I want to put into context the beautifully complex and diversity of this population that makes it difficult to generalize. Taking into context that what I'm sharing may be, from a San Francisco Bay Area centric, but from my own community health work that spans beyond this area, I believe and hope that some of these factors are relatable to those in the audience who are here beyond the Bay Area. So the API students that we are seeing in this area, are ethnically primarily Chinese, Taiwanese, South Asian, Pacific Islander, and Southeast Asian, but they are immigrants, they're children of immigrants, or have been in the area for many generations, spanning decades. And the perception that many of their parents and grandparents were drawn to this area because they studied at Stanford or are technology entrepreneurs or health professionals. The reality is that there are as many as who are small business owners or work in the service industry. So my hope to you and the audience is that when you're thinking of trends of API community and the stereotype of the model minority, it's not that generalizable. There's class, ethnicities, immigration history, and even the degree of darkness that is a factor. So now to kind of shift to, data and trends, and my colleagues on this panel will probably have much more proficient information in it, but where this, some of you hopefully may or may not know this, but the Centers for Disease Control has reported nationwide that suicide is the second leading cause of death for young people 10 to 24. And we include 18 to 24 years old because even though they might not be most of your public health school system, public school system, hopefully those who are here in our community college are also representative. 18 to 24 transitional age youth is also critical. But then when you want to break it down to API males, 1 through 19 years old, they pretty much mirror this national data, but API female youth, suicide is actually the third leading cause of death following cancer. So I'd like to really share more of the qualitative trends, what you see among the API students who have, proactively reached out to us, or even just in community gatherings or just hearing. So what I'm seeing and very proud of is that they're really dedicated to normalizing the stigma. They're advocating for themselves by either testifying in front of school boards, city council, even boards of nonprofits. They're launching clubs to help kind of provide peer support, but also education. They're doing podcasts to just have a safe place to have dialogue without judgment. They're establishing mentoring programs. And this is like high schoolers mentoring middle schoolers, or new college students mentoring high school. So they're doing this amongst themselves. But they're even doing projects looking at social justice intersection of art and mental health, or looking at how sensitive are the school-based mental health services to diverse culture. So a lot of the answers about how should we shape mental health programs and suicide prevention, really, you can start with the community of young people. But one of the things that continues to be a challenge is that while the conversations and the education might be accessible and easy, but how to have those conversations with their own parents, and elders who might be here from, new immigrants as well as multi-generational, who have their own stigma that they're dealing with, and how culture has elevated or elevated, but also in a way that prejudice us against mental health and suicide prevention. And what also brought light to is while we might focus on the family and parents and the young people, we also forget, and I've also seen this, it also gets perpetuated amongst our school administrators, our educators and policymakers. And my hope for those who are in the audience or who work with the school systems is that to find out, be aware of your own comfort level and your own relationship with mental health and substance use and suicide, because it is going to shade and how you're going to advance policies, how you promote a budget that will infuse programs, as well as the staffing. So we talk about implicit bias in regards to racism. How about the implicit biases regarding mental health and suicide prevention and substance use? And primarily our response is just providing a safe place to really elevate and be a champion for our young people, so that those and what also mostly because at this time, as we're maturing and we have transitioned from being a city program into our own independent nonprofit, we're still growing in our evaluation and data collection. But one of the positive stories I really see is, yes, we may work with youth who are really have a passion in this effort, but it's the young people who actually come to our programs because they want simply the service hours and maybe the free food when it was pre-pandemic, and then realizing, whoa, this is something that's relatable to me and it's not as scary. And I really, that feedback of providing service hours came from the young people and providing food to attract their peers who may not normally be interested in or think mental health was something for them to talk about. So I'll leave that there.
And Mary, you, sorry.
Yeah, go ahead.
Mary, you were talking about, instances of implicit bias or unconscious behavior bleeding into perpetuating either policymaking or systems that perpetuate poor mental health outcomes. Do you want to maybe give an example of those cases? Because I think there's a lot of examples where policymakers perhaps unwittingly make these decisions, right, without the intention of doing so. Is there something, maybe a scenario in which people on the call can look out for and to try to avoid that kind of scenario?
Right. I do feel many of the administrators, the educators are well-intentioned, like our own families, right, and so forth. But one example is that, as we all know, fortunately, many of our school systems and districts are getting an influx of COVID response funding, right? And many of that funding is supposedly to also address mental health, but some school districts or some decision makers have decided to use it solely to invest in, the PPEs or to keep more the primary care. And it's nothing negative about that, but what was the decision point that made them not choose to also take some percentage on to strengthen their mental health services infrastructure? Because they have provided it in the past, and it was typically for community youth who needed those services, but also as we are living through the pandemic, it's important to also realize that the positive is that we are normalizing that we are experiencing mental health challenges, and we've had this beforehand. It just rises to the top. So being able to make those decisions about, you have a pool of money and how much percentage will go to actually the prevention barriers of not getting in testing for COVID, which is important. But how do you also deal with the ancillary care, and not only for the students, but also the teachers who are caring for the students and educating them, and the caring adults that they see every day? So I hope I answered that.
Yeah, it's a really good point. I mean, it's always good to recognize that there can be a gulf between what we intend to do and what impacts are happening. And as long as we recognize that, it's okay. So I make sure if anyone else on our panel wants to talk about the trends they're seeing or addressing these latest trends, I'll just give a few seconds. All right. Well, if not, I'm gonna kick the next question over to Nira. So AACI, which is one of the largest community-based organizations serving the AAPI community in Santa Clara County, my home county, what do you think are the mental health needs of AAPI youth, specifically among immigrant, refugee, asylee, and asylum seekers?
Thank you for that question. And I, again, really appreciate this opportunity to address the health and wellness needs of AAPI youth. And I'm going to be intentional saying health, and I'll come back to why that is. On December 7th, U.S. Surgeon General Vivek Murthy issued the public advisory on the emerging crisis of youth mental health and underlying ensuring that healthy children and families will take a multifaceted, all of society effort, including policy, institutional, and individual changes, and how we view and prioritize mental health. And Dr. Murthy identified groups with higher risk of mental health challenges during the pandemic, including AAPI youth, experiencing increased stress due to COVID-19 related hate and harassment, and youth in immigrant homes experiencing language, technology, and other barriers to accessing education and healthcare. You know, and it's so important, again, as Mary said, to acknowledge the diversity of the AAPI community, and the importance of youth voice and choice and services for them, and the seriousness of the issue right now with the suicide rates and things that we're seeing in emergency rooms, and need for acute care. It's not new news that children from minority and marginalized populations are more at risk and experience challenges and barriers to access resources. Gosh, like I said, a second generation South Asian child of immigrants, I come from a place of lived experience and understanding what it's like to be a newly arrived family struggling to navigate a brand new country with different sight, sound, smell, taste, language, different educational systems and healthcare systems. And gosh, even so many years later, despite my educational and training background and many years of working with behavioral health systems of care and with school-based services, I also know what it's like to struggle to find resources as a parent of a youth with behavioral health needs, even pre-COVID. You know, I have the honor to serve as Director of Behavioral Health at AACI, overseeing our array of trauma-informed and client-centered and culturally responsive services that are really addressing the whole person through integrated and collaborative approaches with our health center, wellness, and advocacy services. And AACI was founded in 1973 to advocate for and support the wellness needs of the Southeast Asian refugee community members, which necessarily meant understanding and addressing experiences of discrimination, hatred, and racism. And the dual pandemics of COVID-19 and racism, you know, have had a major impact on all of us. But the pandemic has really exacerbated xenophobia and bigotry towards our AAPI communities and incidents of violence towards members. You know, unfortunately, these are not new issues. We can look back to anti-miscegenation laws, the Chinese Exclusion Act, forced incarceration of Japanese Americans, and so forth to see this. And, you know, members of the community face harassment and discrimination that's rooted in racist history, including this idea of being a perpetual foreigner, the stereotype, which can, you know, brands us as outsiders who will never truly be American. And then there's, you know, the cumulative experience of microaggressions and comments like, oh, you speak English well, despite what generation you might be here or, you know, your background. You know, and it's, you know, I'm not sure, maybe it's the idea of Asian Americans as foreigners and outsiders that makes it, you know, easier to be reasonable targets. But what we do know is that, you know, these episodes range from insults and jokes to verbal harassment and violent attacks in public spaces. And it's significantly increased, right, since the onset of the pandemic. And so we can treat the impacts of the physical violence, those horrific images of those battered and bruised elders. And we're also seeing physical complaints such as headaches, chest pain, stomach aches, other gastrointestinal issues without a known medical cause, which we see as signs of stress, and we can refer to them as psychosomatic complaints. With the AAPI youth we're serving, they're reporting feeling stress, anxiety, fear for their safety, grief, loss, anger, sadness, depression, problems with sleep. with a range of ways that they're coping, including, school refusal, with fear of being bullied at school in person or through cyberbullying, and also maybe having concerns for the elders in their families and not wanting to leave them alone. And we're also seeing an increase in substance abuse and other addictive behaviors, such as problem gambling and eating as a way to self-medicate. The other thing is that these images and reports can really trigger historical and specific trauma memories that community members may have, that either they've experienced directly in their home country or in the journey to get here to the US, and even once they're here in the US as well. And even if the youth haven't directly experienced them, they might also be impacted by generational trauma that's transmitted through the experience of their parents and grandparents. So, really the need for AAPI youth, including immigrants and forced migrants who are refugees, asylees, and asylum seekers, they really need culturally and linguistically responsive services with providers and organizations that they have a relationship of trust with and that address their whole health needs. What does that mean? So that means cultural brokerage and support around adjusting to a new country, support with knowing what resources are available and how to navigate them, housing, food, educational, recreational, spiritual, health, all these things. And that really includes providing case management and linkage, and not just providing a phone number or a website, but really helping with that navigation. Stigma reduction, like Mary was talking about, and psychoeducation for youth and parents around the impact of mental health on wellness and academic success. And then coordinated care that really includes a range of providers, from trusted community members with lived experience to clinical staff. And that again takes into account the youth and caregivers' views of healing. The other piece is access to services on school sites that allow for confidentiality and a comfortable environment that are available throughout the year, especially during summer and vacation times, where they know that their experience are not going to be minimized, that they can emote in their native language, that they can get support for things like safety planning. Even linkage to personal safety devices is something that we've done, planning of safe routes and timings of travel, and making sure they're not going places alone. Unfortunately, according to the American Psychological Association and Substance Abuse Mental Health Services Administration, and from our own review here of Medi-Cal beneficiaries in Santa Clara County, AAPI individuals are less likely to access behavioral health services than any other racial group. And again, why? That's partially because of the stigma that many cultures have against mental health, but also due to the lack of access and knowledge of the culturally and linguistically appropriate resources and providers that are out there. Our mission is to strengthen the resilience and hope of our diverse community members by improving their health and well-being. And again, sort of going back to the beginning, we're intentional about the wording because it's so important that mental health is health, and that we're working to address the stigma. It's really important that we're providing services, either with bicultural bilingual providers or with trained interpreters that aren't family members. And that we have an interdisciplinary team with what we talked about, with having those peer providers with lived experience, to case managers, to licensed providers, medical support services with psychiatry. It's also important to have that continuum of care with different levels of need, from prevention and early intervention, such as like our wellness services, where we've provided brave bystander workshops for youth and young adults, to direct counseling services. I think it's also really important to have this relationship between the schools and community-based organizations that have the flexibility to provide services on school sites or in the home or other safe spaces in the community or in our offices or via telehealth, which is really addressing some of those barriers to care. And also to really, think about providing services such as creative and expressive arts and other whole health initiatives that address mind, body, and spirit and honor traditional healing practices. What does wellness look like from the culture that I come from? And then, collaborative care with schools, primary care providers, and community resources. And I won't go into too much, but another part of trauma-informed services is really caring for care providers and school staff. our bilingual and bicultural team are also impacted by anti-Asian sentiment and are also navigating the effects of COVID-19. And it's been really important to provide support and consistent supervision, emphasis on self-care, like Assemblymember Lee was talking about. So yeah, those are the things that we're seeing. I have a few kind of call to action to summarize, or I can wrap up there.
Well, Nira, let us know your call to action. So those are always, I think, the most important takeaways. And also, I apologize. I don't know if anyone knows, my computer like literally crashed in the middle of you talking. So I just hopped back on. But definitely let us know, what are your calls to action? What do you think are the most important things people should be doing?
Yeah, so really supporting these school-based services and along with a tiered approach, those links to the continuum of care and collaboration with community-based organizations that have those relationships to support diverse student communities, supporting legislation around health parity and access to affordable care, and definitely workforce development and careers in the field. With this crisis, we're seeing unprecedented numbers of referrals, over 30 to 50%, and a workforce shortage with not enough providers, let alone bilingual, bicultural providers to serve them. So we have to make sure that there's sufficient funding and competitive wages, all those things to compensate these also health heroes, right, who've been in the front line and at risk of burnout. The other thing is helping people become advocates. Advocacy is such an important part of the whole health model, and it's so wonderful to see and hear what the youth are doing around that. It fosters empowerment through action, and what that looks like can be really different for everyone. It could be something from volunteering to writing letters to attending peaceful rallies and protests. It can be different things. And finally, stigma reduction. We can all decrease stigma by normalizing accessing behavioral health services and not separating them from discussions about health. And I always like to give that example of just like someone who breaks their arm, we don't tell them to just cheer up and get over it. So too, it's so important that those people that are experiencing those behavioral health symptoms that get the services that they need and deserve.
Absolutely. Thank you, Nira. Yeah, in this day and age, we definitely do not treat mental health enough, even as physical health. And even with physical health, we don't treat it well enough. But that's a good point to be made. Okay. Well, moving on, I'm going to move on to Razelle. As an organization specializing in substance use services, what trends have you seen with the API youth who are serving at AARS? And are there any considerations for schools to be thinking of when it comes to health and well-being of API students?
Absolutely, thank you. First, I always do this. People know that when I do panels or when I speak to folks, I really like to talk about the perspective where I'm coming from. And I am a mother, I am a special needs mom, I'm a mentor, I'm a daughter, I'm a survivor. And what I do for my day job is I am the managing director for Asian American Recovery Services, a program of Health Right 360. And Health Right 360 is a statewide organization that covers about 11 different counties with about 7 different organizations under its umbrella of an organization. And we provide integrated medical, dental, behavioral health, residential, and reentry services, and service about 40,000 people annually. So I like to start off with that because I have so many different facets of my life that really kind of dictates how I answer certain questions. So from my work perspective and your question, Assemblymember Lee, about substance use, I was one of these kids. I was one of the kids at your school that had a hard time going to school because I wanted to hang out with my friends who gang members, drug users, and it was just more fun to cut school than to actually be in school, and found myself, in a lot of trouble academically. And my senior year, I was told that I may not graduate because I had missed so much school. And as a result of that, I went to school in Hayward, California, and there just so happened to be an organization that really targeted Filipino American students. And I was referred to this program, and not understanding what counseling was and why I was being referred, But I think it was a really crucial part in my life that really dictated how I went on with my career in behavioral health, more importantly, substance use. And for the first time, I was exposed to a Filipino social worker who put me in a girls group, who we were forced, or at that time, I felt like we were forced to talk about our problems. And there was comfort, even, outside of the initial shock of why am I in this group? Why do I have to be here? But there was comfort in being around other Asian Pacific Islander girls that were actually going through the same things I was going through. Girls that also used alcohol or other drugs to kind of cope with what they were experiencing in life. And so at ours, I feel very fortunate to be leading ours. We have a program called Project Reconnect, and it was the very first outpatient substance use program targeting Asian and Pacific Islander kids who had substance use issues. And I hold that honor very, very deeply, because it was the first time that, this nation, acknowledged that, hey, we can give monies because there is a community in need. I think if you look at the news right now, you're hearing left and right about the fentanyl issue, the overdose issues that are taking over our communities. And so if you think about it more specifically with the opioid overdose, it's fentanyl, which they're talking about. And fentanyl is 50 to 100 times more potent than morphine, and it's relatively inexpensive to produce. And so that's why it's becoming a crisis in our communities. And if you look at the ethnic breakdowns who is using fentanyl, it's actually, there's an increase of white, Black, and Latino populations. Our numbers for our Asian Pacific Islander population isn't showing there right now. And so when I went back to my team and I looked at, I'm like, what are our kids that identify as Asian Pacific Islander, what are they using? And they are using the traditional drugs that we think of, right? So the gateway drugs, tobacco, alcohol, marijuana. So that has actually remained consistent, and the fentanyl rates, knock on wood, has stayed relatively consistent since 2018 to current. But it's so shocking when you hear some of these stories. I just wrote it down here. Last year in California alone, fentanyl was responsible for 90% of fatal overdoses among 10 to 24-year-olds. And so while we're not seeing that at our organization with the APIs using a lot of the opioids, I do think that that's something that we still need to look into and just kind of monitor. The other thing that we do at ours is we actually have a really big behavioral health, mental health program. And what we're seeing with our kids who are coming in, such as Nira described, with depression, anxiety, that is the main diagnoses that we're seeing. But we're also seeing those same kids who never had a drug issue starting to experiment, and that is their way of coping. And so we did do a little bit of research, and we saw that those kids that had some history of use of alcohol, marijuana, or cigarettes reported 30 to 50% increase during this pandemic. And I really think it's this isolation, it's living in the house. You had separation when parents would go to work or you were in school. And a lot of our families are coming from extended families. So the house is crowded. There is no place to breathe, and so I think kids who were in school, most of the days, and now are at school with their parents, I think the tension is there. Everybody's feeling a little bit of stress and anxiety, and I think it's exacerbated by the pandemic. Something that I wanted to share that I learned from my team members earlier is that a lot of the reasons why our clients are still not coming, and we've talked about this for years, there is a stigma to mental health and drug and alcohol counseling, and even more so with drug and alcohol counseling, because mental health, you can't help it, right? That's the thought that our parents say. You can't help the mental health issue, but you can absolutely help a drug and alcohol issue. So it's a character flaw, oftentimes for our kids. And it was really interesting. We just opened up a 18-year-old female student who's suffering from depression, anxiety, and is actually using marijuana to cope. And she wanted services when she was 16, 17 years old, and her parents said no. Her parents would not consent to mental health treatment because it was going to bring shame to the family. So on her 18th birthday, she called ours. And she said that was her gift to herself to finally get support. And the only reason she got support was because one of her friends went to this organization and received services, and she talked to her friends about it. So, you know, those are some of the stories and the things that we're seeing at ours. In thinking about this panel, it was addressed a little bit by Nira and a little bit by Mary as well. But I really want to call to action for, you know, school board members, school administrators, staff to really invest in services for the AAPI kids, but also to the AAPI teachers and administrators. You know, we've been talking about this. Every platform that I get, I am uplifting this, is that in order to really help our students, we as adults need to be healthy. And a lot of our Asian Pacific Islander, specifically our Asian adults that work in behavioral health, work at the schools, who are charged with holding and navigating students' traumas and fears, are having a really hard time doing that because they're having a hard time navigating that for themselves. And so it's a plea to all of you to really invest. Nira talked a little bit of like supervisions for the staff. We actually did a joint venture with AACI, with Mekong Community Center, First Five of Santa Clara, Gardner Family Health. And we got an outsider to host a listening session. And we call it a listening session, not a healing session, because we don't want our Asian Pacific Islander folks to feel like they're broken, but a place for them to be able to hear each other, listen to what each other is going through, and to find healing in that. So that's my plea to the folks that are on this call is, yes, let's work, let's communicate. I think I saw on the chat is like, how do we teach our teachers like cultural like competence? And there's lots of trainings out there. But what I say to folks is be respectfully curious, ask questions. The students are going to answer them. They're, like, if you're curious about their culture, you know, they're gonna answer, and you'll get those answers directly from them than doing a training. Trainings are important, but really speaking to someone with such respect and curiosity is going to be key in learning about what's going on with the Asian Pacific Islander students in your community.
Absolutely. Thank you, Razelle. And I think it's really important what you highlighted in the beginning about, you know, seeking mental health treatment is much more comfortable in a setting that is culturally competent, or at least where you feel understood, whether it be culturally, generationally, or your issues. And it's always a point, I think, folks who have not gone through the system, like perhaps we have, maybe misunderstand that, you know, it's healthcare, right? It's not like going to surgery is fun. Going to these treatments is not exactly fun either, but it is one of those things that are necessary, and it's made much more comfortable if you have people who feel like they understand you. So it's important that way. Definitely being mindful of time. I want to give one of our other panelists we have not heard from yet, David, some time to talk about some of his experiences. So David, you have extensive experience working in both the substance use world and mental health fields in prevention, intervention, and treatment as a direct service provider to executive management. You're also appointed by President Barack Obama to work on the federal level in the Office of National Drug Control Policy as the Deputy Director of Demand Reduction. And you are currently the CEO of Momentum for Health. However, your most important position, as I've heard you say many times, is as a parent. Would you like to share with us your perspectives as a parent and what you're seeing as needs for AAPI students and the support that their parents need?
Absolutely. Thank you, Assemblymember Lee. Again, I just want to thank the organizers, and particularly my sister from another mother, Naomi. We go back a little bit, a few years. And it is quite the honor to be on this panel. I'd have to say that the speakers before me, it's sort of drop the mic moments, man. Just drop the mic, ladies. Great job. I think I would like to speak more as a parent and former APISBMA member. So I was 10 years on a school board and in the delegate assembly, CSBA delegate assembly for years, and also an APISBMA member. So it's nice to be back. Good to see some old colleagues. But one of the things I just wanted to say, behavioral health issues, I think, are the great equalizer. They don't discriminate according to education, income, race, gender, sexual orientation, and they affect all groups. Just a story, sort of dad's story. So when I was considering this job at Momentum for Health, I was still a presidential appointee, Senate confirmed in the Obama administration. And I remember sitting at my desk looking over 17th Street Northwest, and across the street, the new executive office building. Next to that, the old executive office building. Right on the other side was the White House. And thinking, like, I'm going to go back to a behavioral health agency, and our kids are going into 8th grade and 5th grade. And it's like, ironic, I thought, it would be interesting. It's like we're going back at our kids. That's the age of onset for behavioral health issues generally. And having worked with kids most of my life, I thought, wouldn't that be ironic, come back and lead a behavioral health agency and need services. And literally, what I didn't know is that at that same time, our soon-to-be 8th grader was already experiencing anxiety. And we were moving from Virginia back to California. So in a very short 18 months later, our amazing daughter, still amazing, was homebound due to her anxiety and depression. Our goal every day was to get her to go from her bedroom to the family room couch. That was success for us. And several months later, that all came to a climax when she had a super bad day. I talked to her that day, and she made an attempt. She was hospitalized in San Francisco on Thanksgiving 2017, and she was transferred from an emergency department in San Jose to St. Mary's in San Francisco. And that trauma of that day is very much present today, and it's still present right now, actually. There was no amount of good, whatever achievements, work achievements, anything that either I had done, our family had done, that had prevented that incident, and in fact, in some ways, kind of made it worse. But what our families experience and why we generally try to talk about it, we talk about it with our daughter and with Lauren, and is that we want to share. We want the stigma to be reduced. We want folks to know what this looks and feels like, and that you can get past, you can get help, and that oftentimes the kindness and professional skills of others, particularly folks who understand our cultural and our family background, can be the key help. So here are a few lessons, I think, for us. Staying connected to our kids, whether we think they are doing well or not, is key. Verbal communication. I'm a social worker. We've gone to therapy. And I thought I was really, really good at this. I learned that I was not so good at this, and that I needed to go back, and my wife and I, we had to go back and kind of learn how to listen better. Not judging and expressing our love to our kids, just the foundation for everything. When we were at our lowest, it was very clear to us that grades no longer mattered. It didn't matter. What mattered was that our daughter was alive, and that she felt well. She felt better each day. That may sound like heresy for folks, talking to school board members and administrators and city officials and all, but our family, that was our lesson. If I never have to tell her grandparents or our kids' grandparents that one of their kids felt so bad that they tried to hurt themselves, that day will never come too soon. Being able to talk directly about feeling suicidal. Do you want to hurt yourself? Being that direct. One thing that we decided was that, we needed to build Team Lauren. Her teachers, her therapist, her boyfriend, her, friends, grandparents, everybody was on Team Lauren. Every kid needs a team. Every kid. And, one of the things that I think from a school board member perspective on this, but with what Mary said earlier about behavioral health issues, and Nira said, and Razelle, right? All of our behavioral health indicators for kids are going up. It's very clear. My old colleague, Dr. Murthy, the Surgeon General, when he made that advisory in December, he wanted to make it crystal clear that in some ways our next pandemic is the behavioral health pandemic. It is here. It's in our schools, it's across our communities, all ages. He pointed out the kids. I would say for districts, one place to start is on the data side. The California Healthy Kids Survey data, I'm not sure, when it was defunded, and went to more voluntary, I think more districts should actually use that data and opt into again, know what's going on behavioral health issues in our districts. I think that is so key. The other piece is to look into those culturally and racial groups within the district, even if the numbers are small. Because again, is it any coincidence? It is not that communities of color, LGBTQ communities, religious communities, historically persecuted religious communities of note, these are the communities suffering from and victims of prejudice and continued white supremacy. And they are oftentimes, right now at least, most in need of these behavioral health services, whatever the numbers are overall in your districts. So again, there's so many parts of this that we can parse out for school board members. And I'm hopeful that with interest, from the APISBMA leadership, we might be able to do this again. And again, drill down into certain areas and be able to get into and answer your questions in a more thorough way. So thanks, good to be here with you all. Again, thanks to the Drop the Mic ladies before, Assemblyman Lee, I think, who is phenomenal, because I really appreciate that in panels that we've been on before, and how important behavioral health is, and that I think was a beautiful lead in on that self-care, actually, pointing out the self-care on the cultural part. So
I appreciate that, David. Well, thank you. And thank you for sharing your personal and family story. I've heard it probably many times now, but it is still just as harrowing. It hits you right in the chest, and know how personal it can feel, definitely when you're watching that loved ones go through that. I know we have a couple questions in the chat. I'm going to ask the people that are actually running this thing if we should do the chat questions, or if people want to raise their hands, how should we do other questions? I have a bunch of questions from everything people talked about, but I also want to make sure the audience gets some time to ask questions or get feedback on things they're thinking about. Naomi?
Yeah, I think some of the chat questions have been addressed as they're coming up. I mean, there may be one or two that we missed, but
okay.
Maybe you can go ahead and ask a couple of your questions, and if
okay.
some hands go up.
Yeah, well, I know Mary wanted to talk about cultural competency among school staff. So Mary, do you want to take our very first question in the chat we've had?
Yeah, and I want to amplify and echo what Razelle, and I think that's wonderful for short term. But I do have two additional recommendations for long term to ensure cultural relevance. Frankly, it's important to hire individuals that represent the diversity, specifically, in our situation, AAPI. I'd like to think and hope that, my own staff does reflect the diversity as well as the leadership of the community served. And I'm hoping that, as a first generation graduate of a Filipino immigrants who are also growing up faced substance use around me, addiction, mental health conditions such as bipolar and schizophrenia, and having that lived experience that many of the young people see themselves in my team. And so in the long term, I think there's a limit to having an ally that can't replace that lived understanding. Granted, as a Filipino American, I cannot speak for all and understand my AAPI sisters and brothers. But I think just having that visual and knowing that that person might know my story. The second one is having pipeline programs, not only to have staff or partner organizations to collaborate on school-based programs, but really elevating behavioral health as a career. When you're, especially for our diverse population, including AAPIs, as much as when you're planning your STEM or STEAM programs. So I think that's how I was going to address that. I do have a couple of resources that I'll share because unfortunately I'm not accessing a computer, so I'm afraid I might disconnect. But I think if those two steps those three things to do in the short term, and I think we all can take the trainings, but those two other things is about institutional changes that policymakers, administrators on this call have the power and influence to do.
Thank you, Mary. It was a great question, I think, in our chat right now from David Kong Greenfield, or David Kong from Greenfield USD. David says, my school district has a very small AAPI population, but I don't want to ignore any of their mental health needs. How can I reach out to the students to see if they need help? So as a school board member, how do you think is best way to reach out to students in need? Razelle?
I could take this.
Yeah.
I think teachers that really care about this population need to be out there. They need to be present. They need to be known as an ally. So whether it is introducing yourselves to the students during lunchtime, or putting out office hours, or maybe potentially starting up like an ally group where maybe there's like if you have a group of Chinese students, and if they wanted to do a lunchtime group, become their sponsor. And that's how they get to know you, and then they get to understand that you care about them and can support them. I think Mary's absolutely right in we need to hire folks that look like our students, but it's really hard. It is really hard when our population is not naturally drawn to this profession. Our API community is not drawn to being a teacher. It's not drawn to being a therapist, a social worker. It's just not. And so I really want to echo that, where we have to highlight these services, these professions. And I think API community, they really value like health. So like doctors and nurses. Well, guess what? Teachers, behavioral health workers, they are health workers. So if any which way you can rephrase, because I think words matter, it's like I have to tell my parents, I work in the healthcare field. And then they feel proud, because when I used to say I'm a social worker, they didn't understand that. So I do think that's one part of, a way to kind of reach out. But to the person that asked the question, get yourself out there, get to know the students. Like Dave said, even though you have a small population of APIs, you never want to regret not reaching out to that one student, because something could happen and it could be devastating to the entire school. So reach out.
You know, if I could, I'd want to add too. Everyone's got their own reason why they became a school board member. I just want to share this panel gave me the opportunity to go back and talk to kids that I had worked with, 15, 17 years ago. I just asked them, like, what was it that seemed to work? And these folks have actually reached out either through Facebook or whatever, LinkedIn, and after years, just come back and just said, hey, I just want to say thanks. So it gave me an opportunity just to, a few years ago and to now to ask them, what was it culturally? What that one of the things is representation matters. Is that, it's funny. One of the kids said, here we are in Daly City in northern San Mateo County, just south of San Francisco. Everyone's Asian, it's like everybody's Asian. It's like, and yet none of the folks that were running things were Asian. So we'd be in meetings and then we'd have kids there and they'd look around, they go, Dave, there was nobody Asian except for you that was in any sort of position of sort of any, influence. And I thought about it, I go, I actually ran for school board because a counselor sitting with one of the kids we were working with, high risk, whatever, great kid, is this guy had no time for this kid at all. He wanted to come back to school and he was getting pushed to GED, to go to GED. And I was like, if a kid wants to try to come back to school, even if it took him a little extra time, it's like that kid should, and I just told that kid that I ran for school board because of him. And he never knew. And so partly, I think from a school board, say, you can do that. You can sit and talk to these kids. You can go out. You can find the staff, as Razelle said, staff and faculty who are connected with these kids, and then they can ask, right? But somebody's got to be in those conversations with folks, and they have to be, staff and faculty representing the district to show that the district and the school care. And they are communicating that not only to the kids, they're communicating that to the parents. If they can do that in language, even better. Wow. All of that, they're there. I think they're in the district. And, we had Latino staff at ours and even at AACI that would work with other, other Asian kids, or because the experience was this, that cultural humility that once man, it transfers. Folks that are good at it, you see them right here on the call, right? These are experts that do this. So, and they teach it. Is utilizing those staff, yourself included, to be able to send that message out.
Fantastic. I think that also segues to one of my questions I always have in my brain. And it's really good. I think it is empowering for people to reach out to their communities as much as possible. I'm out there much in the community, and I cannot tell you how many questions I get about things that I'm like, well, I'm going to connect you with someone who's a specialist on that. I'm not qualified to answer that question, but they know I'm out there and present in the community. And it takes an immense amount of courage for someone who's vulnerable to reach out. It takes a lot, right? And if you are there and they know you're someone of repute to come to, that makes all the difference. So that brings me to my question is, if on this call, there's so many great leaders out there, someone does come up to you and they're like, I think I figured it out. There is something wrong with me. I need help. What's that first step? What do you tell people to say, okay, this is how we should proceed in the situation, given that not all of us are wonderfully astute in this medical field as all our panelists are, but what is that first step you would advise people if someone reaches out to them for help?
I can start us off here. I actually just had this conversation with my staff. I had an all staff meeting this morning, and I talk about active case management or active engagement. And I think it's easy to hand off.
Hey, Razelle, you froze.
Oh no, Razelle's still here for me.
Oh, sorry. Maybe she froze. Oh, on my connection. Sorry.
Sorry, no. Technology. But I was saying active case management or active engagement. It's a whole lot easier to hand over a phone number to a parent, to a student requesting for that help. But too oftentimes what we see for those that are requesting for mental health and or drug and alcohol services, it takes a lot of effort to actually build up that courage to do it. So if they're not met with immediate results in regards to their help, the chances are they're not going to call that phone number that you gave them. And so I really, if you have the opportunity, sit down with that student, call the referral person, whoever you have, to do a warm handoff is always going to be better than just giving them a phone number or directing them to a website. And that was one of the messages I gave to my staff this morning, because we actually had 3 different walk-ins, and the 3 different walk-ins last week had 3 different results. And the result that came out best was a person that was immediately sent to the office of a counselor who was able to do a quick assessment and screening, and then got them enrolled immediately. And then the other 2 we still have not heard from. And those 2 were given business cards or websites to research.
And Nira, I just want to bring you in as an organization that often gets the warm handoff to that send. Do you have advice about how to deal with those situations if someone reaches out to them for help as well?
Yeah, absolutely. I mean, it's it really helps to have partnerships to be able to do the warm handoffs, and supporting them to follow through. So whatever resources they need to be able to do that. So we find that sometimes there's a struggle if the youth can't get supports at home or after school to be able to get pulled out of class. And so, those kinds of, I think, supports are really important to be able to, have that coordination of care. And, it also depends on what the youth and the caregiver feel comfortable with in terms of sharing information. If they are comfortable, that collaboration and communication is really important. So the more school-based partnerships there are, the more helpful it is. And when you have a range of services like prevention, early intervention with people that are in the classrooms, doing classes, doing after-school programs, and they're building that relationship of trust, then the likeliness of the follow-through to connect to services is even higher.
Thank you. And I just want to make sure if Mary and David had anything they wanted to add to this. I did see Mary go off go off mute for 1 second earlier.
I think I defer to Nira and Razelle. They did a wonderful job, but
Okay.
I think there was another question in the
Yes.
chat. Yeah.
Yeah, Mary, if you want to take that question you saw.
Okay, so the question, I know Sarita from AACI also responded about the parent engagement. So as we all know, parent engagement is not a new challenge or issue that many of us are facing. But what I've learned in these past 2-3 years, the pandemic, the racism reckoning, and the anti-API hate efforts are giving us an opportunity and mandate to do work and solve this very differently than we've had. And many AAPI cultures, and as well as other communities of color, really value that extended family context. So when you are developing your student-centric mental health programs, being content that the parents and the educators and administrators will learn through osmosis is not a good program design. It's really critical to look at your funding and your initiative to see how you can reinforce, because in the end, while we start with the youth first, the burden should not be on them. It's really us who have that power and influence. So we also are getting an infusion of resources. So this is the time to innovate. This is the time to say, hey, how can we do this differently? And really, how can we make it more system level and collaborate not only within your community, but across districts, especially in the Bay Area. Many of our communities are not, they cross counties and regions, unlike our more rural areas. So that is my charge. And I think this is an exciting time for you who are on board to be able to feel you have that authority to make those bold decisions. And I will share, if you really want to, also for those who don't work with AAPI, I don't know if you know, Each Mind Matters is a statewide movement that really looks at normalizing, and there's a great section that looks at the diversity of our populations, not just only ethnicity. And if you want to hear some of the stories of the young people, they have video recorded, and these are young people who've actually submitted and just tell their stories throughout California. And maybe you might discover there's one youth who is probably in your district. Thank you.
You know, if I could, I would also just, you know, add to what Mary was just saying. You know, again, the school that our kids go to, we went to, one graduated, and then it was the work at the school level that allowed our daughter to keep moving along on behavioral health, that allowed her to stay in the class. She was, you know, under a 504 plan, and I was already thinking IEP. I was thinking, and they're like, no, we can do this under the 504 services. And I'll tell you, it was the school response specifically that allowed our daughter's now at West Valley Community College. She's getting ready to transfer. It was that response. And so the schools have it within their ability to actually, I think, and do this all the time, you know, are already doing it. But I think, can we do it better, you know, more widespread? I think that's what this discussion is about, how to get down into underserved groups better. And, you know, particularly in the AAPI community. You know, heck, I mean, the AAPI community is so diverse by itself, right? So, you know, I think to Mary's point, this is our time to make that turn. I think the feds see it, the state sees it, locally we see it. This is that time. In education, I think, you know, needs to is charting a new course for, you know, for this century. And the pandemic is our great opportunity to reframe this.
Absolutely. Well, thank you all so much for sharing. You know, I know we're running short on time, so I just wanted to share one note, and I would engage. Thank you everyone for being engaged. But, you know, so from my vantage point as a state legislator, I sit on two probably most relevant committees here out of the 7 that I've served on in the first year. Is that I sit on the education committee and the budget subcommittee for education. So all the money and all the policy on education that, you know, you all are so passionate about governing and changing, I sit on that. And I say that just to point out that, you know, all these struggles and things we're trying to change in our school system, especially with regards to behavioral health, we don't have to do it alone. You know, we can work collaboratively across regions, across layers of government. And I think, Darshana, you just shared the thing about what I wish my parents knew as a Zoom panel. And if you have, you know, a good relationship with someone who has slightly larger platform, like your state legislator, your congress member, why not host it together, right? Because the one power that, you know, politicians we have is that we were popular enough to get people to vote for us. So you know that we can convene people. So that's our one superpower that we have, right? So definitely branch out, reach out, and see how we can help you in these efforts. And at the state level, as you all know, as school board members and school administrators know right now, we have to balance the services and the funding right now, right? And I'm trying to do all we can at the state level to balance that out right now so that you can have all the great resources you need to be having. And I think that's how we work collaboratively and intersectionally, right? And the last thing I was going to put a plug in is I'm also the policy chair for AAPI caucus. So if you have an idea out there, why not pitch to us? If you have an idea, obviously don't like say, oh, Hail Mary in the state just solve it for us. But like if you have an idea out there and you want to see it done really well, something I've noticed really well is if a school district has done something really well and they want to export that practice across the state, that's something that's really helpful too, right? The knowledge sharing, something I always tell people and constituents that come to me is, you know, the chances are if you have identified a problem in society and also a solution, there are probably 5 other people at least in your own neighborhood or your own region that have thought of the same thing. And if we work collaboratively together, we can make a lot of change. And just as we often say with people who are going through troubles of their own, you know, you're not alone. So in this struggle together, we are not alone. We can work together on that. And with that last note, I'm going to hand it back to Andrea to close us off because we've only got 6 minutes left. So.
Thank you, Alex. I really appreciate all of our speakers today. I want to thank all of our accomplished panelists for joining us. I'm so impressed with our speakers. We are extremely grateful for their time and sharing their expertise and personal stories in this critical area. And I agree with David Mineta. There were many drop the mic moments today, and there is so much to cover. on this important topic. And I believe all of our panelists agreed to come back and do a deeper dive if there is interest. I hope that each one of our attendees walk away with some insights and understanding of how to support the mental health and well-being of AAPI students and bring back to your school districts, especially during policy development. And I'd like to also add, just a reminder, a recording will be made available on the website and on Facebook as soon as it is available. And we will send an email to all of our registered participants with links and resources discussed today. Before we close our meeting, I would like to ask all attendees to take a quick poll before exiting. This is important to APISBMA so we could develop relevant and improve our programs in the future. And while
Andrea, sorry for interrupting. May I just put a plug in to continue the work? If you could save the date for March 21st, we have another program coming up. And so for all of our attendees, please, March 21st, we're going to be sending out a save the date reminder for you and tell you a little bit about another program that we're running, which is very similar to address the API needs.
Thank you, Shelley. That would be great. So March 21st. APISBMA is doing so much this year. Will someone be putting up the poll, Sylvia? So while Sylvia is putting up the poll, I would just like to thank the APISBMA board, and in particular, Naomi Nakano Matsumoto, our Northern VP, for doing the heavy lifting and securing our panelists and moderator, Assemblymember Alex Lee today. And if you haven't already, please become a member of APISBMA. Your membership will help us to further our mission. Information can be found on our website at apisbma.org. And we look forward to seeing everyone at future events. And thank you for spending a part of your Valentine's Day, which shows us how much you care. So have a nice evening. And APISBMA board members and panelists, please stay on for a debrief. Thank you to all of our attendees for being here today.